We'll go back to our regular schedule, and I'd like to call Dr. Aarti Heda ma'am to speak on outreach programs and serving the community internationally.
So good morning, everyone. This topic is very unique and difficult for me to talk, but I'll try to do my best. Outreach programs and serving the community internationally. So let's first talk about what is a community service. It is unpaid work performed by a person or group of people for the benefit and betterment of their community without any form of compensation. And being a doctor, we are expected to do this type of community work very often. And to some extent, we do this in our day to day practice. Let's say we have just prescribed a medication to our house help, or maybe you've prescribed a medication to your relative. So that is also kind of a community service. So according to the World Health Organization, at least 2.2 billion people globally suffer from some form of vision impairment, with at least 1 billion cases being either preventable or yet untreated. When it comes to cataract surgeries, it is estimated that around 20 million cataract surgeries are performed globally each year, with a significant portion supported by charitable organizations. So let's talk about what can be done under community services. Outreach programs in ophthalmology that serve communities are crucial for addressing eye health disparities and providing essential eye care to underserved population worldwide. They play a vital role in reducing the burden of preventable blindness and improving access to quality eye care services. Outreach programs often begin with screening camps where trained healthcare professionals screen individuals for common eye conditions, let's say cataract or refractive errors. These camps are usually set up in rural or underserved areas where access to eye care is limited. Once individuals are diagnosed with eye conditions, outreach program provide treatment options, let's say doing a cataract surgery. So surgical camps are often organized to provide free and low cost surgeries to those in need. So the outreach programs also focus on training of local healthcare workers and ophthalmic technicians to enhance their skills so that the system is not dependent. So there's long list of organizations that are doing community services at this stage. I mean, it's not possible to cover for anyone how long the list is. Few of them who have been popular are Orbis, Sight Savers, Seva Foundation, then Operation Eyesight Universal, and there are a lot many groups from US. They do a lot of community work. Like one of them I am associated with. So how can you do a community service? You can give your clinical and surgical expertise to treat the patients directly. You can be involved in teaching activities and be mentor to students and budding ophthalmologists. You can provide training to the healthcare workers or volunteers on the basic eye care practices, let's say just to identify a common health disease. If you have, let's say, if you have come to a stage where you can support these things financially, then maybe you would like to give the financial contribution as well. So the very important question asked to me at least is, how do you enter these organizations? It is very difficult. It is not very easy, let's say, to catch up a good group and then be associated with them for long term and do the community service. So what you have to do is you have to keep looking on the options, keep looking on their work, keep following their work, write them an email and ask, say, hey, I'm this specialist, do you need any helping hand? I have been trying to write one kenyarelief.org. I must have written them 10 emails, and every time I get the response that no, we are not in need of any anterior segment surgeon at this stage. So there are a lot many organizations, they go to remote areas, especially in Africa. So it's the best way is to just follow them, write them an email. The other option is you can speak to your mentors. They might know lot many people, those who are doing community work. Like I was talking to Dr. Santosh Shunawar sir a couple of years back, and then he says that why don't you talk to Dr. Sangwan? He does he has done a lot of work with Orbis. So talking and discussing with seniors can also open up a lot many options for you. First of all, you need to ask yourself that why do you want to do this community service? Somebody who has just finished the fellowship, and might not be in like stage to do a lot of community work for the reason that he has to earn as well. But then the other thing is that he might say that, oh fine, let me go to a remote place, or let me go to Africa, and let's get a lot of hands on. So it depends entirely on you, that why do you want to do it, how frequently you can do it. Second question is you should ask yourself. You can't say that I'll go 1 month and live in Lebanon, and let's say I'll come back to in 2 months, 1 month back to India, and then I'll have my own practice here. It doesn't work that way. There has to be a continuity wherever you are. Let's say if you are in an organization, they won't allow you to go for a month and come back and join them. So it depends entirely on your situation, how much charity you want to do, how frequently you want to go, when do you want to go, and for how long can you do this. So there are various challenges at personal and professional level when it comes to community services. So if in case I am traveling to one particular country, I'll have to have a license to practice in that country. I'll suggest that don't touch a patient if in case you don't have medical license, or let's say a special permission from medical council over there, because if in case you land up in a trouble, it will be difficult for you to come out yourself unless you are with a group who definitely is going to take care of you and bring you back to the country. It's not that I want to scare you, but just be careful. There are lot many consumable issues. You feel that fine, this group is coming from US, so they can bring up lot many things over there. But believe me, it's not possible to get at times the things which you really need to do simple surgeries like viscoelastics or Blurex or mitomycin C. So be prepared that if in case you don't have a good phaco machine, you should be able to do a good SICS surgery. Have your expertise for that. Like I travel to Tanzania for surgery, so I carry lot many SICS sets with me, because I've seen that they don't have adequate instruments, and if in case I have to do back-to-back surgeries, then sterilization is a problem. There are a lot of personal issues as well, challenges as well. I say that when it comes to community work, you have to leave your family back in India and then do this community work. So supposingly you have a child of 1 year, and you say that I want to go for 10 days. So you'll have to have a good support system back here to take care of your family. You'll have to always have that risk of infectious diseases, which is very common in eastern part of the Africa. So the topic given to me by Karan was this serving the community at international level, because I have been doing some work at international level. So I have been associated with Africa since the year 2016. And I have worked on both these sides. So I have worked with a corporate hospital as well as I am doing the community work. So not to boost myself, I just want to share my experience with you. So this is from my recent visit in Tanzania, and this is one of my very happy patients, first day of SICS. So the NGO I am currently working on is based in US, and they have these visits every 3 months in remote places of Tanzania. So we went to a place called as Songea, which was very far, and when I came out of the aircraft, I was already on the main road. So I just realized how small the airport is. I literally survived with white rice and bhujia save there for 10 days. I lost 2-3 kgs of weight over there. But the service which we gave over there was really satisfying. So we did a lot of SICS surgeries. We saw a lot of patients related to glaucoma and retina in OPD. And the best part of the visit was to train the residents over there. So the rule is of the organization I work with that we don't have to operate everything ourselves. We have to teach them so that when we come back, the system is not dependent on us and we are leaving something back over there. So these are some of my very happy patients, and of course we all have our sets of testimony and all from our patients. So there was this issue by Nupur and her team, which was published by AIOC Bio Times. It had experiences of lot many people, those who have worked at international level. This might not be related to the community work itself directly, but it definitely gives you an idea that if in case you want to move outside the country, what all options you have. So it's a very good read. And yeah, of course, I have also written a chapter in this. So thank you once again, and if in case you have any questions, I'll be happy to answer.
Uh, Thank you so much, Aarti ma'am. So, firstly, I would like to congratulate you and commend you on the incredible service that you've been providing for the last couple of years. So, two questions just for the benefit of the audience. So, what were your three most challenging situations over there? They need not be related to ophthalmology. You can mention related to your travel as well. And secondly, for those just listening in, many of them are probably inspired by you and would probably want to take up something maybe even this year. So is there one place that you would recommend that, okay, just start here, other than the Wyo Times issue that you have mentioned?
Okay, so when it comes to challenges, you want me to give three challenges. So I'll just share a small experience. So when I was going for my last visit, I was at the Mumbai airport, and I was holding my boarding pass and passport, and I just kept it, and I was trying to just organize myself for the security check, and somebody picked my passport, and I was not able to find it. So I almost went on the panic mode when somebody shouted that, oh, fine, I have your passport. So this was one. Then I went to the airport in Tanzania. So it was a domestic transfer. And the security guy says that I have given you, the check-in guy says that I've given you your passport. And I say, I don't have it with me. So I actually went on panic mode that what if I lose my passport here? Though it was just a small thing. So finally they found it and I got it after 30 minutes. I went to a hotel to check in over there, and there was another Indian who was checking in with me, and they gave my passport to him by mistake, and he did not find a room over there, so he left from there. So when I'm asking where is my passport, they say, oh, we don't have your passport with. So this has happened in the one visit, and believe me, it was very difficult situation for me emotionally to handle that. Oh, what will I do without a passport? The second challenge I told was food. Food was a very big challenge. I thought that maybe my parents won't allow me to go back if in case I lose 10 kg over there and go back. The third challenge is trained staff. So it is very difficult to work with somebody who is new and you are expected to do all complicated surgery, let's say 30 surgeries in a day. You want to work on your own speed, you want to work in your comfort zone, but it is, the communication itself is difficult. You take a lot of time to train them. You have to be very slow, very gentle with them. So the work culture is also very different.
So every time that you went there, would you train different residents?
Yes, so I have been to different parts of Tanzania and I have not repeated the hospital yet. So every time you have new sets of resident, every time you have new sets of staff getting trained under you.
Right.
And day one you start and you'll realize that how much work you'll have to do with them so that by 10th day they are trained enough so that they can work together, the resident and the staff.
That's excellent.
But then I have been based in Africa for 3.5 years. That was a western part of the Africa. So this is what I'm talking about is Tanzania for my community work.
Right, right.
Aarti, I would assume that there wouldn't be any VR backup when you're performing these cases. So what happens?
No, we don't have any VR backup.
And again, I would assume you wouldn't have had any complications. But if someone would have them, what do you do in that case?
So most of the places we operate, they have air connectivity. So the thing is that Dar es Salaam has a lot of VR surgeon, 4 VR surgeons. So we've spoken to them, like 2 of them are very good friends of mine. So if in case anything happen, we have that backup that we can fly the patient to a VR setup and we can get things sorted. And we have basic vitrectomy machine over there. There are 3 machines so that if one fails, the other can be used. And basic anterior vitrectomy and let's say secondary IOL, those things the surgeon there can do. Like I'm one of the chief surgeons, so I can do.
So 4 is a big number when it comes to VR surgeons there.
Yeah.
Surgeons, 4. Yeah.
So I have 6 on the road that I practice in Lucknow.
Have you had any issues with sterility?
No, not yet.
Not yet. Okay, thank you.
But the one of the photo, if you would have noticed, I was just walking the hospital I visited last time. I was just walking with my dress and footwear, and I just realized that, oh, I'm in the theater. I'm like, okay, fine. The theater.
Right.
So I didn't even realize that I've entered the theater. So yeah, but then we've changed many things over there. I'm grateful to ICORPS and Dr. Susan. She's got a very good team. So we've changed many things in definitely few parts of Tanzania as of now.
What's the patient attitude towards doctors coming from other countries?
So I have spent lot of time in Africa, and I'll say a big culture difference when it comes to patient. So let's say I've operated a end stage glaucoma patient, assuming that the patient might get some vision, or let's say ambulatory vision. If in case I've not got the result, I was disappointed, but the patient will come up and tell me that, you know what, doctor, you have done your best, so don't worry. I know that you have done your best. So the attitude of patient toward you is like you are actually a god for them. And I have seen this different lot of difference between our culture and their culture. So you, if a patient is walking inside your OPD, we tend to just ask कि क्या तकलीफ है, what complaints you have, and we are not even bothered to greet them and all. But then if in case you forget to greet a patient, they'll greet you, of course, and then they'll ask you, how are you doctor today, how's your family? So this exchange of greeting and lot many these small things na, which I have picked up from there, is something which I really want to continue for rest of my life, even in India.
Right. Okay. Thank you so much,
Thank
ma'am.